How to study pharmacology in second year MBBS. Number 1. Core topics in pharmacology. General pharmacology, ANS, CNS, PNS, autocoids, endocrine, CVS and respiratory system. Renal system, blood, GIT, chemotherapy and miscellaneous. Those topics which I have highlighted with a star mark are important in point of view of exams. Number 2. Choose a book which suits you well, but standard book is preferable. Go through the books which I have reviewed in my previous video and choose the book which you are comfortable with in reading. Always choose a book which your university or college recommends. Standard book is always preferable in reading pharmacology. Number 3. Core headings of each class of drugs. Classification, mechanism of action, pharmacokinetics, adverse effects, therapeutic uses, contraindications. Classification of drugs. Classification of drugs is very important in point of view exams, so therefore one should practice thoroughly from a standard book and stick them on a wall for regular repeated revisions. And because remembering drugs is a difficult task, so therefore one should actually make regular repeated revisions. And also it carries more marks in LAQs and exams, and also it helps you to answer well in Viva. Because sometimes the external examiner might be a good person, might just ask you the classification of drugs, and that's where you'll be able to fetch more marks. So coming to mechanism of action, study mechanism of action of main drugs in every class of drugs, because there are certain drugs which are more important in terms of therapeutic indications than the others. So try to study them from a standard book, because they are not just important for the exam's sake, but also for understanding certain subjects in like medicine, anesthesia, etc. in your future in the MBBS journey. Next, coming to pharmacokinetics. This includes absorption, distribution, metabolism and elimination. It is not very important in exams because it is rarely asked. Study for those drugs which exhibit important pharmacokinetics. Next, coming to adverse effects. Focus on important adverse effects and try to make mnemonics of them and revise them regularly, because adverse effects are very important in university exams. They will be asked in many questions. So therefore, you need to focus on adverse effects for sure. Next, coming to indications and contraindications of drugs. Study only the specific indications of drugs, because remembering everything is not very easy. Coming to contraindications, they bear more importance in entrances than in university exams. They're also important in understanding certain subjects like medicine, etc. Number 4, some important tips. Don't neglect general pharmacology, because it's very important in understanding systemic pharmacology. And also try to make notes from the starting itself with your own presentation. So this will definitely help you in presenting your answers in finals. And also try to be consistent throughout your academic year. It's not about the speed, but also it's about the consistency. Thank you everyone for watching this video. Like, share and subscribe for more videos.